In 1 minute preceptor, we have 5 micro skills: get a commitment, probe for supporting evidence, teach a general principle, reinforce what was done well, correct learner's error, and make recommendations for improvement. First, get a commitment from the learner about what he or she thinks is going on with the case. Then probe for underlying reasoning to explore the learner's understanding. Then teaching general rules pertaining to the case, and after that provide positive feedback about what the learner did correctly, and in the end correct learner's error and make recommendations for improvement in 1 minute preceptor. In SNAPPS method, summarize, narrow differential, analysis, probing, planning, and selection for self-directed learning. In summarization, you will ask the learner to summarize history and findings, then question about the differential diagnosis with 2 or 3 relevant possibilities, then analysis of the differential diagnosis by comparing and correcting the possibilities and contrasting them, then the probe, the preceptor, that is done by the learner for uncertainties, difficulties, and alternative approaches, then planning the management, and then select a case related issue for self-directed learning. Unique bits of SNAPPS, learner initiated actions, and reversal of typical interactions. 1 minute preceptor is learner centered, as is the SNAPPS. The role of preceptor and learner are equally important in 1 minute preceptor, but in SNAP, preceptor has a less responsibility than learner, except for the 4th and 6th step. Feedback is there in both SNAP and 1 minute preceptor. Purpose of 1 minute preceptor is enhance teaching via 5 micro skills in OMP, while in SNAPPS focusing the teaching specifically on learners' need in SNAPPS. Training for preceptor is required in OMP with additional cognitive capacity, and also required in SNAPPS, that is change of role from expert to facilitator. Learner has no responsibility per se for training in OMP, but yes, they have to focus to tasks that are given to them in SNAPPS, and they are forced to take lead in SNAPPS. Effective clinical teaching tool. Knowledge and reasoning of learner is assessed in OMP, where it is learner initiated in SNAPPS. Teaching or instruction geared to learner level. Yes, so in OMP, and in SNAPPS it is learner directed. Application of knowledge, disease specific, higher order thinking in OMP, while learner control in SNAPPS. Indications of use of OMP for learners who need preceptor guidance and facilitation during interaction, whereas for SNAPS, advanced learners and is inappropriate for novice learner, unreliable history, unorganized oral presentation. If such things are there, SNAPS is not a good method to teach such students. OMP and SNAPS, cognitive learner perspective, require active engagement of learner in clinical reasoning, activate learners' prior knowledge and apply it to case in hand, that is bridging, learners' pattern recognition and illness scripts are better developed and retained, push learners to margins of their capabilities to address uncertainties found. These are cognitive learner perspective in these methods, and preceptor or teaching perspective is that it requires effective preceptor who communicate knowledge to learner in understandable and powerful way after diagnosing the learner, focusing of teaching on few key points in each case, that is memorable teaching, not overwhelming the student.